Did you know that most people with lung cancer don't have any symptoms until the disease is advanced? Lung cancer starts in the lungs. Abnormal cells cluster to form a tumor, and as they multiply, the growing tumor interferes with the lung's ability to provide oxygen to the body. When diagnosed, staging is used to describe or classify the cancer by its extent in the body. In stage 1, the tumor is confined to the lung and hasn't spread to the lymph nodes or anywhere else. Stage 2 means the tumor has spread to the lymph nodes within the lung. The tumor reaches stage 3 when it has spread to the lymph nodes in the middle of the chest, known as the mediastinum. And when the tumor has spread to other areas of the body, the cancer has reached stage 4. It is at this point that the cancer is labeled metastatic, the most advanced and incurable stage. The lung cancer type can be categorized based on the cells in which the cancer started. The majority of cases are known as non-small cell lung cancers, and most of the remaining 15 to 20% are small cell lung cancers. Lung cancer is the most common cancer in the world. 1.8 million cases were diagnosed in 2012 alone worldwide, and in 2015, there were 1.69 million deaths worldwide related to the disease. In 2016 alone, it is estimated that 28,400 Canadians were diagnosed with lung cancer, making up 14% of all cancer cases in the country. And that in the same year, 20,800 died from the disease. This is more than a quarter of all cancer deaths, and more than breast cancer, prostate cancer, and colorectal cancer combined. This represents an average of 57 Canadians who succumb to this disease every day. Signs and symptoms of lung cancer include a persistent or worsening cough, constant chest pain made worse by deep breathing or coughing, blood-stained sputum, shortness of breath, wheezing, fatigue, loss of appetite, and weight loss. While smoking is by far the most common cause of lung cancer, the reality is that smokers, ex-smokers, and never smokers are at risk. In other words, if you have lungs, you can get lung cancer. In addition to smoking, other risk factors exist, including exposure to radon, secondhand smoke, exposure to other substances, a family history of lung cancer, air pollution, and radiation therapy to the chest. However, due to widespread prejudice linking smoking with cancer, many patients and their family members often feel isolated and hesitant to share their diagnosis with others. Screening tests, such as CAT scans, are still commonly used in identifying patients with lung cancer. The discovery of new diagnostic tools and treatment options has changed the way the disease is treated. For example, biomarkers are substances found in the body that serve as a guide in the personalized treatment of lung cancer, while new discoveries are emerging, such as targeted therapies and immuno-oncology treatments, which use the body's own immune system to fight lung cancer. With such progress being made, researchers, medical professionals, patients and their families are hopeful that by working together, they will continue to succeed in reducing stigma and improving support, research, and innovative therapies to help reduce lung cancer rates in Canada and around the world.